All right, welcome back. Covering America, what's in it for you? We're going to continue our conversation, particularly as it pertains to when you have a pre-existing condition. Why wouldn't the Republicans and Democrats agree that if you're going to have health care reform, everyone should be covered, even if you have a pre-existing condition? So Jaquita Williams here is talking about her situation. She's a breast cancer survivor. She had a question for Congressman Gingrey, and now the question goes to Congressman Eliot Engel, who's joining us from New York. So what would the Democrats have to say about a promise to make sure that Jaquita would still be covered?
Well, Ms. Williams, your case is precisely what President Obama and the Democrats want to do, and why we want to change health care. We believe very strongly that in any bill that comes out, no one will be denied any kind of help because of a pre-existing condition. Right now, insurance companies are denying people like crazy. The Republicans seem to think that you could sort of leave the insurance companies to their own, and somehow or other they're going to come up with something good. We have seen that unless there is pressure, unless the government changes the way health care is done in this country, the insurance companies will never respond. So our bill will ensure that no one can be denied coverage because of a pre-existing condition. Our bill will absolutely be that if someone loses their health care coverage or loses their job, they will be able to get similar coverage or keep their coverage. That's precisely why we need health care reform in this country, and for you to have to pay all these bills out of pocket when you thought you had good insurance that covered you is a national disgrace. It's a national scandal. So I can assure you that any bill that comes out of the Democratic House and Senate and signed by President Obama will take care of people just like you.
Well, that's exactly what I want to hear.
Well, you'll hear it, and thank you for having the courage to say what you're saying, because we have heard this from thousands and thousands of people who are just like you, and that's why the insurance companies and health coverage is broken in this country, and we need to fix it.
Yeah, and Congressman, a good number of the 47 million uninsured Americans are just like Laura Walker, who's also with us. She lost her job, which means she lost her insurance. She is not covered at all right now. So, Laura, your question perhaps to Congressman Gingrey first.
Well, I just talked to a friend of mine today who actually was diagnosed a year ago with cancer. She lost her job right along with me. She informed me today her COBRA didn't even pick her up because it was considered a pre-existing condition. I think my biggest question at all to both of you and to the American government is, if all these people have been putting their money into insurance companies, and the insurance company takes the money, they invest it, they buy real estate, they do stocks, whatever, and that's supposed to make the money to pay the payments back for the treatment that you're getting, if they can't make it work, and the government continues to put all of these regulations and stipulations into developing drugs and to how things are done medically, I don't understand how the government is going to pay for it to make it any better. I mean,
Congressman Gingrey, why don't you respond to that?
Laura, absolutely, and I said on the previous clip that a situation like yours, you've been paying into that system all along, and certainly you have made money for the insurance company because possibly you had very few claims, maybe annual physicals and that sort of thing, and then all of a sudden you come down with something, heart disease, diabetes, breast cancer, and you want to change jobs, or you lose your job through no fault of your own. That company, that insurance company that was covering you all those years, should be obligated, because you've got credible coverage. They should be obligated to continue to cover you at near standard rates, and that's what we will. That's what the Republican Party will insist on.
Well, I feel like both of you, Congressman, are actually saying the same thing. So
well,
I'm
we
having a
are.
hard time understanding
to some extent,
why
we
is
are.
it on the Hill that we're hearing there's such dissension, and we keep hearing an injection of the Democrats are believing this, the Republicans are believing this. You both sound like you're saying the same thing, so what's the problem?
Well, we very much are saying the same thing, and I'm sure Eliot would agree with me because he's my good friend. We could get together. We could have gotten together on the House side, like the Senate's Finance Committee is working in a bipartisan way, but we have not worked in a bipartisan way,
Congressman
unfortunately.
Engel, give me a timeline.
And
then.
I'm a physician. I can add to this.
If it sounds like that there is a lot of harmony here, what's a timeline? What can Americans expect?
Well, I would hope by the end of the year we would have a health care bill ready to be passed and signed by the president. Phil's a good man. We work well together. But unfortunately, his party, when it comes to health care, has been the party of no. They didn't like Medicare and Medicaid back in the 1960s, and they don't believe that the government should play any role in health care. We know that before Medicare and Medicaid came through, 80% or 75% of American seniors were living in poverty, and now with Medicare and Medicaid, that's all been turned around. So we don't think that we should be afraid of the government getting involved. We think that by the government getting involved, it will force the insurance companies to keep their premiums down and to provide health care. The lady who lost her health coverage, that's the kind of person we want to help.
Laura.
If you lose your job, or if you change jobs, if you're a little bit older and you're fearful that you're going to be fired and won't be able to find another job, we want to make sure that you will continue to keep your health coverage.
What's interesting too here, Congressman, is we are talking as if everybody does want this kind of government plan to be passed, period. But we're also hearing from people, and Josh has been hearing from them via Facebook and blog and on my Facebook page as well, that not every American actually wants to see this kind of government intervention. Josh, if you could join the conversation real quick before we take a break. Okay. What is it that people are expressing when they say, I don't know if I like the Democrats' plan, I don't think I like the Republicans' plan?
You know, you can tell me, and we can do some now, we can do some after the break, but we're definitely hearing from a lot of people who are making those exact